really pleased right now to introduce Bob Lawrence, Bob Lawrence is the founding director of the Center for a Livable Future, and he's a professor in the Department of Environmental Health Sciences at Johns Hopkins Bloomberg School of Public Health. And his center supports research and develops policies related to public health impacts of industrial food animal production, improving food security, and adopting healthier diets. And Bob, I very appreciate that you've come here to talk to us today.
Thanks very much, Dr. Hesh. I'm pleased to be here. I'm a little intimidated by all of you who know so much about nutrition. When I graduated from medical school, my sum total of exposure to nutrition science was that I had learned the essential amino acids in the biochemistry course, and on my internal medicine rotation I learned how to write a diabetic diet. So I've often had people ask me what kind of chutzpah I have that I should have started a center to examine the food system. But I am delighted to be here and to see so many good friends and to see people that I've had the pleasure of working with on previous IOM committees, including Helen and Jim. I am going to allude to a couple of those committees in the course of my remarks. But Maria sent me some very specific questions, and I dutifully followed them, Maria, because I thought you'd probably put a lot of thought into them. So the first one was this: to what extent are the health effects of the current food system driven by the number of consumers and their incomes? Well, that seems like a fairly straightforward question, but I think in fact, it gets at the heart of our understanding of a lot of the dynamics of the food system in the same way that Gus talked about going from an 8 billion bushel corn crop to a 14 billion bushel corn crop. We have gone over the last 20 years from a time allowing for a constant of about 30 to 35% wastage in farm to fork food. We have actually gone from about 2,300 available calories per capita per day to something on the order of 2,700 or 2,800 calories. So I would reframe this question a little bit to say that there have been a dynamic within the food system relating to a lot of the things you're going to be grappling with that has led to, despite a growing population and despite somewhat stagnation at the lower end of the income distribution of real constant dollar incomes in the last 20 years, there has been an increase in access to foods, but the quality of that food may be the problem. So if we think about the public health burden related to that, I think we want to actually say, is it just population and income? We know that price elasticity for food is markedly less than it is for some other opportunities in public health. Price elasticity for tobacco for teenagers, for example, is quite high, so that we can take advantage of tax policies and other things to actually mitigate the smoking problem. But many studies have shown that price elasticity with regard to food is more muted. And I think one of the challenges for you to wrestle with as a committee is to think in what ways can the affordability of healthier foods be used as an incentive to modify eating habits. But industry practices, consumer behaviors, and government policies, I think, are really at the heart of the matter to answer this first question. And if we think about industry practices, that tremendous growth in highly processed foods, rich in fat, sugars, and sodium. And we know from studies that people at the low end of the economic distribution are often, toward the end of the month when their SNAP benefits have expired, they turn to the cheapest food, and the cheapest food is often highly processed because of the low cost of those three main inputs. We also have to deal, as other speakers will talk about later, resource depletion, ecosystem degradation, and climate change. But these also do have health effects. So You know, climate change now is increasingly creating a situation with heat sinks in our great cities. We have, I woke up this morning to the news that the cooling centers in the city of Baltimore would be open at 11 a.m. this morning. Despite that, there will be frail elderly people living alone in un-air-conditioned apartments who will suffer significant ill effects from what we are now seeing more commonly with climate change. Ecosystem degradation with regard to everything from pollen counts and introduction of new invasive species that lead to different kinds of allergic responses. So it's a complicated set of questions that were embedded in that first question. But I think that from the perspective of your work, the heart of the matter and the real meat in developing some guidelines for the framework you're going to develop will be in this area. Now, practices also as a way of highlighting the fact that transformation in our food system has had both positive effects but also some negative effects. And production methods, processing, packaging, distribution, marketing, and retail practices all have opportunities for us to examine what some of these health impacts of the current food system are. And they are mediated through these different pathways. Farming and meat processing, slaughterhouse work remain two of the most hazardous occupations in the country, and I'm pleased that Keisha is a member of this committee because she, as director of our Occupational Health Injury Prevention Center at Hopkins, is very knowledgeable in this area, and one of my colleagues in the Center for a Livable Future did her dissertation work on injury prevention and focused on slaughterhouse workers, which with line speeds going up, with the hazardous sharp knives they use, etc., this continues to be a significant unintended negative health effect of our current high meat diet. We also have a lot of contamination of the environmental media, air, water, and soil. Increasing problem with microbial and chemical contamination of food. And then I've already alluded to the market saturation with high fat, high sugar, nutrient poor food. The next question that Maria posed was this one: in developing an assessment framework, how should we distinguish the minimum health effect of any food system of this scale from the effects of the system we have compared to the effects of feasible systems that could exist? If I didn't know Maria better, I would think she was torturing me when she sent me this list. This is a really tough question. So one way of thinking about it is that this is the current situation, a pretty big public health burden. I may have exaggerated it in contrast to the size of the box plot for the current food system. And obviously we would love to get over here with a minimized health burden from a minimal impact health food system. But despite my optimism, I'm a realist, and I think what we ought to be trying to do is seeing how we can preserve some of the important elements of food security, preserve farmer productivity, increase wages for everybody in the food chain, and to do that within a system that minimizes but obviously doesn't completely eliminate the public health burden. I'm going to come back to that a little bit later when I talk about the framework that was developed by a recent IOM committee on valuing non-clinical preventive interventions. And obviously diet is one of the major non-clinical preventive interventions available to the public health system. So if we think about research in this area, how do we leverage policy to curb the aggressive promotion of nutrient poor energy-dense foods. I know everybody in this room is aware of the fact that the Chain Restaurant Association, the beverage industry, and the candy industry together spend $14 to $15 billion a year on marketing. McDonald's alone is at around $950 million. So the SNAP program, efforts to improve nutritional counseling, the social marketing that is done by public health groups pales in comparison. I remember when NHLBI introduced their 5 portions of fruits and vegetables a day as part of their big program on controlling hypertension back in the 1990s. The total amount available for social marketing to educate the American public about the benefits of increased portions of fruits and vegetables was a minor rounding error of the amount that is spent by McDonald's alone. So we, within the context of First Amendment rights and so on, this is a real challenge for the public health community and a real challenge for improving the food system and beginning to actually quantify the negative impacts of this massive marketing of sugar-sweetened beverages, of high-fat, high-sodium, and high-sugar processed foods. How do we transition to a farm bill that fully weighs the negative externalities of our food production system? Gus has already talked about this, and I think that from a public health policy perspective, this is a rich area for research. But I think that the ability to actually influence policy in this domain is going to be enormously helped by the recommendations that come from your group with regard to putting a metric around the actual disease burden and the expense to the U.S. economy of continuing to have such a nutrient-poor, high fat, sugar, and sodium diet. And then this is a really tough one. We were chatting briefly at lunch about our current non-evidence-based policy mechanism in the U.S. Senate and the House, and how we can restore science to a position where good data and sound evidence really has a voice in policy. And I think that we already know a lot that could be implemented with policy recommendations. There might be minor disagreements around what areas to emphasize and so forth, but I think it wouldn't take very long in this room of collected experts for you to have some very, very important policy recommendations for the Farm Bill that wouldn't have a chance in the current political environment. So how do we address that as a researchable question? What do we need to do in terms of studying the political process in this country to make science-based food system policy once again a possibility? Next, Maria wanted me to address this question about gaps in knowledge due to lack of appropriate measures and methods to examine the question, and what metrics and analytic methods would most help advance the field. So I'm going to, in a few minutes, give 3 examples of the challenges with regard to teasing out the contribution of the food system to some of the most important diseases that we face in the U.S. But first of all, I think we can make a lot of progress if we engage in more multidisciplinary systems thinking. Very hard to do that. The coin of the realm in most of our academic lives has been very Cartesian, very much reducing the number of variables so that we can actually isolate something, and the food system is far too complicated for us to do that. I thought Matt's recent prospective clinical trial of crop rotation was a beautiful example of how within the complexity of the overall food production system, you didn't narrow things down so much that you couldn't keep track of inputs, you couldn't keep track of yields, you couldn't measure a number of the things that made the results so credible and so useful to drive farm policy. Industry transparency. I think that we know only a small amount of what is available in terms of scientific data. We know from the perspective of the large processed food companies that they have some very, very intelligent scientists who are doing things to do everything from measure and quantify the texture, the feel, the crunch, the taste, the combination of sweet and sour and salt and so forth. Well, if we could somehow engage industry, it would obviously, at the moment, it appears it would be entirely against their business interests, but to encourage them to use some of that science to move our American diet into a healthier direction, we would achieve a great deal with regard to some of the major burdens of disease. The food system effects in the presence of multiple non-food system risk factors. For example, tobacco, lack of exercise, exposure to environmental toxins, undiagnosed and therefore untreated hypertension. If you just look at cardiovascular disease alone and then try to figure out what are the best methodologies that we could use to dissect out the contribution of a carnitine-rich diet of regular meat eaters, to give you a little preview of what I'm going to talk about from the Cleveland Clinic studies. But that's a real challenge, very difficult to do. Nutrition science in the presence of human disease with so many other risk factors contributing makes it very challenging to define the variance of the disease burden that can be attributable directly to the food system. Social and behavioral determinants of diet choices in relation to education, disposable income, and other socioeconomic factors. A rich area, a lot of people doing very good research. How do we draw from that to also develop some metrics that can be applied to assessing the true value of the food system and its contributions both in a positive and negative way to human health. Now, this is from the IOM report that was released last fall on valuing non-clinical preventive services. And when we started, we felt overwhelmed by the challenge in the same way that I suspect a number of you are feeling by your challenge. But food is only one small part of what we were asked to look at. So just give you one example. There was a new light rail system built in Charlotte, North Carolina, and an enterprising investigator decided to follow prospectively a cohort of people who became regular users, turned out to be about 7% of the Charlotte population, and a cohort of people from the 93% who continued to roll out of bed, walk through their heated garage in the winter, climb into their SUV, drive to the garage underneath their office building, take the elevator up, and sit in their desk chair all day. Guess which cohort gained weight over the year that he followed them? Well, yes, it was the latter one, but the surprise was that the first cohort, the people who adopted public transportation and used it regularly, lost on average about 6 pounds. So if you calculate the health impact of something like that and think about replicating that in a national transportation policy, you can begin to see some of the opportunities in thinking about food systems. We ended up with two basic ways of thinking about the framework. The first was this, the benefits and the harms, both from the point of view of actual health of individuals, but then also community well-being. So what does it mean? When Gus talks about this tremendous growth in farmers markets, and then alludes to the fact that in Brooklyn, I think it was Brooklyn you talked about, Gus, that real estate developers like to have bike paths and farmers markets near their new development because that'll allow them to charge higher rents. Is that community well-being? It probably is. But we need better metrics for it. And then community process, and by community process what we meant was that whatever it took for a group of people to overcome the resistance of our car-dominant culture to encourage a bond bill in Charlotte, North Carolina to put in a light rail system. That effort, that work, learning who the stakeholders were, learning how to build coalitions, learning how to advocate, that is community process that's ready then to take on the next challenge that will have health benefits, community well-being, and community process. How do we think about that in terms of food system? Are there ways of structuring the kind of work that you're going to do to say, well, let's take this piece and work on it so that we can then demonstrate with empirical data that it improves health of the affected population, that it adds to community well-being, and that it starts a process that allows things to go from there. So the practical farmers of Iowa, I don't know how that got started, Matt. Who is the kingpin, how it's growing, what impact it's having, how it is building social capital as well as improving agricultural practices. But there are case studies like that that I think each of you could probably come up with. And then finally, the identification of investment and resources. So we have to decide what's going to be counted. You can't count everything. Are there elements of data that can be indicator conditions for food system valuation that will be more reliable? Perhaps they're easier to collect, and so forth. Now, quickly to give you some examples. This is from Walt Willett's group, the Nurses' Health Study, 83,000 individuals, combined with the health professionals study that I'll show in the next slide. They had 2.6 million person years of follow-up. 2.6 million person years. That's an epidemiologist's dream. And it allowed them to define relatively narrow confidence intervals for total meat intake servings per day as a hazard ratio against a non-meat eater. So by the time you get up to 3 servings a day, you have 1.5 greater risk, all-cause mortality, cardiovascular disease, and cancers. For the physician group, the health professional studies, a smaller cohort of 37,000, the slope of the curve is actually a little steeper. So by the time you're eating 3 servings a day, you're more like 1.7 hazard ratio for all-cause mortality, cardiovascular disease, and cancers. But the dilemma is translating this in a meaningful way to figure out what proportion of this change is truly related to meat consumption versus confounded by all the other things that happen to go along with the lifestyle, the habits, and the behaviors of people who are heavy meat eaters. So these are heavily confounded but nonetheless useful studies to consider. This is from the Cleveland Clinic just a few months ago, Keith and Wang. They had a very interesting approach. There's some recent work that shows that choline and its products, trimethylamines, things like carnitine. Carnitine is highly present in red meat as well as poultry meat. And if you have regular meat eaters, the internal biota, the bacteria living in our gut, tends to have a dominance of organisms that love to use carnitine and other choline producers as their primary fuel, and they end up producing trimethylamine N oxide, which is a potent atherosclerotic agent. It is probably the atherosclerotic agent associated with high meat diets rather than cholesterol, as has been thought for decades. So here they had a group of vegans and vegetarians. They actually persuaded the vegans and vegetarians to come in and eat an 8-ounce steak in the morning in a fasting state, and then they had regular meat eaters come in and eat an 8-ounce steak, and then they took hourly blood samples and then 24-hour blood samples, and they measured carnitine levels and they measured trimethylamine N oxide levels. And what they showed was that the vegans and the vegetarians, numbers are obviously very small here, N of 5, they didn't bump at all with regard to plasma levels of trimethylene N oxide because they didn't have the bacteria in their gut ready to break down carnitine and make this atherosclerotic compound. Whereas the omnivores had a brisk spike during the 2, 3, and 5-hour samples, wide confidence intervals, and then it decayed over 24 hours. So again, you might say, well, this is a real game changer with regard to the health effects of a high meat diet. But lots of other potential confounders here. Effect size needs to be fully calculated, a lot of other things, but it's a very suggestive area of beginning to quantify the impact of our current high meat American diet on health. Finally, to illustrate some of the epidemiologic challenges, sugar sweetened beverages, there have been a lot of studies, but most of them, the 95% confidence intervals crossed unity or they abutted unity, and a meta-analysis actually demonstrated that indeed if you are a 1 to 2 soft drink consumer per day, or a sweetened juice drink or sweetened tea, 1 or 2 a day, compared to somebody who rarely consumes a sugar sweetened beverage, you have a 26% greater risk of developing the metabolic syndrome of hypertension, elevated cholesterol, insulin resistance, and obesity. They then looked at the relationship between sugar sweetened beverages and type 2 diabetes. And again, you see a number of these small studies. Really, the confidence intervals crossed unity, so therefore it was very difficult to interpret them with any statistical validity. There were a few like this. The plot sizes each reflect the number of patients in the study. So there were a few of the larger studies that actually stood on their own. But when they did the meta-analysis, confidence intervals tightened, and it showed definite relative risk of 1.26 for regular sugar-sweetened beverage consumers compared to non-users with regard to developing type 2 diabetes. So you could build from this. You could model based on what we know about population consumption of sugar-sweetened beverages, the total burden of disease caused by type 2 diabetes. Now, there are a number of things that I didn't have time to go into detail, but I have them here as a listing, and they're available on the PDF that I sent. A lot of interesting things emerging about cancers, foodborne pathogens, and antibiotic-resistant infections. I'm sure you'll be looking at in great detail. We have malnutrition and hunger in the United States. So the food system is not only causing obesity, type 2 diabetes, and the metabolic syndrome, but it's also causing stunting, hunger, and that needs to be addressed. And then finally, chemical and heavy metal contamination. Keith Nachman and my group has been publishing a lot about arsenic in chicken meat, arsenic in feather meal that is used as animal food for beef, swine, poultry, dairy. And we will probably be advocating for new EPA and FDA standards for heavy metal contamination based on some of those findings. There are also farm and slaughterhouse injuries that need to be quantified related to the nature of our current food system and looking for opportunities to intervene. Exposure to environmental hazards of pesticides, pathogens, airborne hazards from IFAP, such as industrial food animal production, such as ammonia, hydrogen sulfide, endotoxins, danders, dust, fomites, etc. And then finally, both community and population health hazards, which would require a different metric in order to capture the full impact of the food system, as opposed to the cumulative burden of individual patients suffering directly from diseases. But such things as nitrates in the drinking water, toxic microorganisms in surface waters, the nuisance and mental health effects of IFAP odors, the kind of work that Steve Wing at UNC has been doing in the eastern coastal plain of North Carolina. Antibiotic-resistant pathogens, novel influenza and other zoonotic diseases. Matt was telling me that Iowa now is either number 1 or number 2 in laying hens and egg production, as well as, of course, being number 1 in hogs. And in the virology world, we think of people, pigs, and poultry as the great mixing bowl for emergence of new pathogens. So, check your health status and your immunization status when you travel to Iowa, I guess, is the story. Excuse me, Helen, I didn't really. And then finally, there are indirect health hazards associated with the ecologic impacts of industrial agriculture, climate change, resource depletion, and land use. With that, I'm going to close. But do I have a minute? Or am I out of time?
You have 1 minute.
1 minute. I just wonder how many of you have seen this Measuring Our Lives by Joseph Stiglitz, Amartya Sen, and Jean-Paul Fitoussi. It was commissioned by President Sarkozy when he was president of France back in 2008, just at the beginning of the economic crisis. And it's really a fascinating book. The economists in the room probably would appreciate some of the subtlety more than I did. But Sarkozy says in his foreword, if we give no value in our accounts to the quality of public service, if we remain locked into an index of economic progress that includes only what is created and not what is destroyed, if we look only at gross domestic production, which rises when there's been an earthquake, a fire, or an environmental disaster, if we don't deduct these from what we produce, what we consume in the course of production, if we don't include the drafts that we are drawing on the future, if we don't take account of how innovation is accelerating capital depreciation. He talked about how the half-life of a computer or a smartphone compared to the half-life of a farm tractor or a refrigerator. And if we, how can we expect to realize what we are really doing and face up to our responsibilities? I think you can substitute food system in a couple of places there and summarize the real challenge for coming up with new metrics for the work that you're going to be doing. So thank you very much.
Thank you very much, Bob. I saw elements of a framework in some of those slides that might be very useful.